Hello and welcome to the CDO Magazine interview series. I am Neel Butala, co-founder of HiLabs and a cardiologist at Mass General Hospital, Harvard Medical School. And we're partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. Today I have the pleasure of talking with Ashok Chennuru, Chief Data and Analytics Officer at Anthem. So we're just going to dive right in. We're going to talk about first, building a high quality data foundation in health plans to improve the member experience. So, traditionally the focus in using data in health plans to improve member experience has been on acquisition and interoperability. Recently, quality of data has been identified, as critical to drive improvements in the member experience. Has that been your experience?
Yeah, good morning, Neil. Good to be here. Thank you for having me. We at Anthem are an innovation leader dedicated to improving health and making healthcare simpler. Through the affiliate companies, we serve over 107 million members, including 45 million members as part of our health plan. We aim to be the most innovative, affordable, valuable, and inclusive partner. We are radically committed to simplifying healthcare for our stakeholders, which includes our consumers, employers, and the communities we serve in. Our digital-first approach provides consumers an opportunity to engage in a spectrum of care services, starting with digital, virtual, and physical in-person. Consumers can engage in technology like chatbots, conversational AI, and then have a virtual care and then do an in-person visit as needed. Through this holistic approach to meet the needs of the whole person, we are creating and delivering innovative data-driven solutions that are personalized, proactive, and predictive. So data is in the center of everything, Neil. So to simply answer your question, yes, data quality is the foundation of everything we do. And we are looking at really, it's not enough as data moves from one system to another within the organization. It's not enough to just, have the traditional ways to monitor the data quality. We need specialized solutions. We need to be able to, trace the data. We need to be able to have solutions that can measure the quality and the impact of the data and the governance around it as it moves from one system to another. The traditional rules-based approaches, will not help solve this problem. So AI-based solutions, with platforms that can scale, is really how we are looking to address this issue end to end. And that's where the partnership with, HiLabs MCheck product really has helped us to build AI-based, machine learning solutions that can proactively monitor the quality end to end and address it.
Perfect. So staying on the topic of data quality, provider directories are also a key pain point, both for health plans and their members. Bad directory data can lead to poor member experiences, decreased access and surprise billing. And as a physician, poor provider directory data definitely affects how I see patients and what patients come to see me. How is the Chief Data Officer of Anthem are you approaching this problem?
Yeah, great question. Provider directory accuracy problem has been a long-standing one for the industry with no easy solution. The key challenges are that there's no standardization or source of truth given the fragmented nature of the provider market. The other major issue is that providers are overburdened with the day-to-day work of delivering care to the patients and the administrative task of keeping and sending accurate directory information to all the different plans is understandably a time-consuming and not a high-priority task. The unique challenge in this area calls for a fairly unique solution. Anthem approached this problem by first understanding that we cannot achieve 100% accuracy, and therefore we needed to adopt a probabilistic approach to improve the accuracy as much as possible. To make our directory data as accurate we started to leverage a combination of internal data assets, such as our claims data and existing provider data sets, in combination with external data from the vendors like LexisNexis, and also publicly available data set from the web, such as data on the provider websites were considered. Lastly, we needed to come up with an intelligent way to weigh these various sources to calculate an accuracy score and set thresholds for action based on the score. And the approach I outlined, we started to deploy it in our Georgia market, and by end of the year, we plan to have it rolled out in all our states.
Great. And, data quality has also created challenges to combine both EMR and claims data for the purpose of improving patient access and care coordination. What would you suggest to startups and health tech entrepreneurs who are navigating or even trying to address this issue?
Yeah, great question. So when we look at the whole person, see Anthem's, in the theme of simplifying healthcare for our stakeholders, we look at the whole person health, which is a combination of our traditional claims data, but also, like you mentioned, the EMR data that we get from the providers. Think you have seen our recent announcement with Epic as well, which is one of the largest medical records, platform in the country. So in addition to our claims data and clinical data, we also consider the social drivers of health, some of the emerging data sets like genomics, and we aggregate all of that data into what we call a longitudinal view, whole person health. So as far as what the entrepreneurs should focus on is build solutions that can really take our data or take the data and turn it into actionable insights, and then see if those insights have created the needed impact, and measure and then repeat the same process until you achieve the outcome. We have a framework within Anthem called DIAL, data, insights, action, and learn. So it is a continuous and a repeatable process until you can really turn your data into value. So also be ready to build anything that can scale and can go after both traditional data sets that are structured, and also be able to get unstructured data and turn that into a value as well. So in essence, the key here is build solutions that can scale, but always keep focus on making sure we have the right governance around this data, the right quality metrics. So you are really sending good quality data to AI, because your models are as good as the quality of the data, and also have good metrics around how this data is being used. Because sometimes some of this data can generate unconscious bias and may not be able to be trustworthy. So explainable, trustworthy focus is equally important.
And thank you, Ashok, for joining me today. And please visit cdomagazine.tech for additional interviews.